Good morning, and thank you for joining us on Good Samaritan Facebook Live. My name is Adam Thacker. I'm the Chief Operating Officer. As you probably noticed, I'm running solo today. Dr. Stein had other commitments that he had to tend to. So going to start off with our usual, giving some updates on the numbers. In Knox County, as of this morning, we have a 5.1% positivity rate for all tests. The unique individual that we often focus in on is at 12.8%. So I've seen that come down a little bit since last week, which is good. We want to continue to see that trending downward. If you look at the state dashboard, you'll notice that Knox County is in the yellow status. So there's blue, yellow, orange, and red. So the yellow is that we have minimal transmission of COVID-19 in the community. So we are still seeing some transmission. We're kind of on the cusp of moving to blue, which is the goal. That's the lowest end of the spectrum as far as transmission. And a lot of that is tied to we've continued to have some nice weather. I'm sure our farmers would like to have some rain, but we have had some nice weather, which has allowed for staying outdoors, staying spaced out. So all of that tends to be working very well. We'll have to be really diligent as we move into cooler months and move inside and making sure that we're following all of those guidelines. Masking mandate is still in place. And I would call attention to our 10 health districts. So Indiana is broken up into 10 districts. We have within our districts, we have 7 counties to the south of us that are all a score of 2 or higher on that 0.5 to 3 scale. Pike County actually is at 3. They're the only county in the state that have jumped up to that level of transmission. So even though we're sitting in that yellow and feeling pretty good about where we're at, we're in this southwest corridor. We're still seeing a fair amount of transmission, and obviously there's a lot of regional travel to the south of us, so making sure that we're diligent with all of our practices in maintaining those social distance, those masking, hand hygiene is really important as we move into the fall months. Hitting on our schools continue to do very well. Have regular meetings with them and have seen very low transmission, and when they do have occurrences, very proactive, and that has really helped our overall community numbers because that's a large gathering place. We've been fortunate to continue to have on-site learning opportunities for our students and want to be able to maintain that as we move forward. So kudos to them and how they have been performing. We have 61 active cases in the community, and those are the cases that are quarantined at home and recovering, or a very small percentage of them may be in the hospital recovering as well. We have seen, as with the lower community numbers, we have seen our census here at the hospital for COVID-19 patients really low and settle in to where we have resources both from a personnel standpoint and from an equipment standpoint to take care of all of the individuals and have capacity to add to that where need be. Our testing sites remain the same. Convenient care out on Willow Plaza and the Medical Center of Vincennes are areas where you can get tested. If you have questions about symptoms or potentially an exposure, what do I do? First step would be to call our triage line. That's on our COVID website, or it's also 812-885-3331. That's staffed by a team of nurses that can help to guide you to either need to be tested, monitor your symptoms at home, potentially set up a virtual visit with one of our physicians to have a provider assessment performed. They can help to coordinate all of those activities and answer general questions about what you're experiencing or any of those concerns. So that continues to be an avenue to really get the ball rolling if you need an access point. We talked a lot about vaccine in the past, and as we move forward, certainly we're coming up on flu season starting to pick up. So first vaccine I'll hit on is Influenza Vaccine. Tomorrow, actually, we are going to be performing a mass vaccination drill with our own employees here at Good Samaritan. So our goal is to administer vaccine to over 1,000 employees tomorrow, both during the day and into the evening. And that just helps in preparedness for if we have a rollout of a COVID vaccine, that we would need to enact those types of processes and to learn from that. And then after tomorrow, the 14th, kicks off our community flu drives, and we will have drive-through options. Those will be posted on our website and available starting October 14th, and we'll run through the 21st. So we'll have both day, evening, and weekend availability for folks to come through. That is an adult vaccine program, so 19 and older will be eligible for that. We have our pediatric office is offering vaccine to the pediatric population, and we are looking at additional dates for pediatric patients that are not current patients but need to be able to access that vaccine for influenza, because as we've talked about many times, we're going to move forward into this convergence of a flu season and things moving more indoors, and we still have the COVID season. We haven't figured out exactly what that season is yet, but the COVID is still very, very present as we move into the fall. So that vaccine really helps to mitigate the number of flu cases that we're seeing in this county and ideally on a nationwide. As far as the COVID vaccine, that continues to move forward. We're working with our state resources. As for availability, we don't have any dates on that. What we do know is it will be a phased approach, and likely we will see that vaccine be offered to our healthcare team first. High-risk individuals that we have talked about with heart and lung disease that can have a more difficult time recovering from coronavirus. And then it will be phased throughout the populations, likely into next summer, is based off what we've seen from CDC and their guidance as that moves forward. I did want to comment over the weekend. I saw that there were a couple of news feeds and 60-minute type of events that were talking about the president's treatment. We have, since the beginning, we have been able to access through studies convalescence plasma, remdesivir, steroids are used all the time, and those types of treatments that have been made available and used on a nationwide basis. The antibody cocktail that you hear about is experimental. It's not FDA approved at this point, so that's not available on a widespread basis to healthcare institutions. Nowhere here in Indiana is it available. As more information becomes available with that, and if it does gain approval, then that's something that we will be able to access. That's the Regeneron product that is out there and being looked at. And we're continuing to see more and more advances in treatment modalities for COVID-19. And as those advance, the Good Samaritan team is able to access all of those. As they have the FDA approval, we're sure that they're safe and effective and able to move forward with those. So we'll continue to update that on a weekly basis as we see changes. We're in stage 5. I did want to mention that as we are in stage 5, the masking mandate is really important, again, as we move indoors. But I think there was a lot of that thought process of 4.5 to 5. Initially, the very, go back to May, stage 5 was more of a return to normal. There wasn't mask. Everything was wide open. Stage 5 has been abbreviated and revised in that capacity. We're seeing more things open as far as restaurants and gyms, those types as for capacity. We've seen the increase from 250 to 500 for events that require approval from the health department, but masking, social distancing still stay in place. See a lot of variation in masking compliance in this county and in neighboring communities as well. So please stay diligent to that. I will tell you that there's been very few times that we've had a very sick COVID patient in the hospital that has said, I should have worn my mask, or I was the one out there not wearing a mask. It gets spread from person to person, and a lot of the individuals that are at high risk are being diligent about wearing the mask, but it takes everybody in the community that is committed to that for it to truly work as well as it could. So please think about you're protecting your neighbors, your friends, not necessarily just yourself. So with those updates, we'll see if we have any questions. Or maybe I just covered everything so well there's no questions.
There are no questions right now, but it looked like maybe we lost connectivity a couple of times. So just real quick, explain the flu clinic for the community and that process again.
Okay. So if we did glitch out during the flu discussion, Influenza Vaccine this week. So tomorrow kicks off our mass vaccination drill for our employees here at Good Samaritan. that we will be offering as part of our way to plan in moving forward for if we roll out mass vaccination. And then starting the 14th through the 21st, we will have various dates that will get posted out on social media and our website for the adult community to be able to access. All right, and not having any questions, appreciate everybody that attended. Certainly you can post questions later to our social media page and we'll make sure to get responses to those. Have a great week, and we will be back next Monday.